Hello dear friends, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010. Today I'm going to talk to you about two unofficially used drugs. These are antiparasitic drugs that have a very wide range of effectiveness against different helminths, parasitic infections, but nowadays, because of their good preclinical data on different tumors, they started to get more popular and widely used by oncological patients all over the world. And the good news, they are attracting the attention of also of scientists. That's why they are also studied in some clinical trials. Of course, these are ivermectin and mebendazole. And we will talk about general information about these drugs, about their preclinical studies, about mechanisms of action against cancers, and we will talk about dosages, unofficial protocol, about clinical trials, and about adverse reactions and contraindications. Also, I will tell you several case reports on separate patients who were taking it. So, let's get started. If you see this article, it's on albendazole and mebendazole. These are very highly used antiparasitic drugs that can actually treat not only intestinal parasites, but also that are spread in the body, in the skin, even in the brain. That means they are very bioavailable, they can reach and they can even go through the blood-brain barrier that protects our brain from all the other blood of the body, extra protection of our central nervous system. Even there they can go and can be treated potentially for different brain problems, including brain parasites. And that's why, of course, they are often used in different brain tumors. There are 2 case reports on mebendazole and 2 case reports on albendazole that show that they can be very promising, and they have a good effectiveness on cancer cells and on animals with tumors in different types of cancer, like liver, ovary, prostate, guts, breast, head and neck, and melanoma cancers. Also, they have potential effect in, for example, leukemia. But because albendazole is more toxic for bone marrow, may often cause this loss of white blood cell production. That's why mebendazole is more highly investigated and used, because in this case we need cancer patients need to take it longer. That's why when the use is prolonged, it may cause more side effects. By the way, not far ago I did the lecture on fenbendazole. It's a veterinary antiparasitic drug that has some interesting case reports, some interesting data, and also is highly popular among patients because of Joe Tippen's case and his protocol. If you want to know more, please watch this video. I show there some real patient cases, and let's talk a little bit about general information. So mebendazole is used in many parasitic infections, but also because it can block microtubule formation, and it can decrease the uptake of glucose into the parasites. Microtubule disruption may actually also affect tumor cells because they cannot divide and they will undergo apoptosis or self-killing. Also, mebendazole can block the blood vessels formation, and this decrease of intake of glucose is very important. We talked about mitochondrial metabolic theory of cancer, that one of the main fuels for tumor is glucose. That's why the approach to block glucose, decreasing it in diet, like keto diet, or using some drugs to decrease its uptake. For example, mebendazole, we see here, it decreases uptake of glucose. Mean it can support this metabolic approach, trying to starve the tumor, potentially. Also, mebendazole can actually affect cancer stem cells because cancer stem cells are the most resistant to all chemo drugs, to radiation therapy, and many data tells us that cancer stem cells are the reason for all recurrences and all resistance to treatment. For example, this article says that animals with breast cancer, triple negative, that is very aggressive, and they had a metastasis in the brain, and when they gave them mebendazole in food, meaning it's very bioavailable, even when taken by mouth, it can decrease the spread of tumor in the brain and improve the survival of these mice. Other articles here was talked about glucose uptake, and it's a stomach cancer, and it says that it really decreases the uptake of glucose. And here the ovarian cancer, it works through p53 system. So mebendazole is widely used antiparasitic drug that is repurposed to cancer because of its good preclinical effectiveness against many types of cancer. It is highly bioavailable, it can go into brain, and also it's quite safe. Rarely patients experience any serious adverse reactions. And the second drug we're going to talk about, it's just a general information for now and preclinical information. We're talking about ivermectin. It's also an antiparasitic drug. 2 scientists got Nobel Prize for it because it was very effective against a serious problem such as river blindness. And it saved a lot of people from this problem, from this parasitic disease. And here you can see 2024, a fresh article, that ivermectin has other potential benefits, not only antiparasitic. We know there is a lot of information now about our favorite viral infection of 2019, but still it's not in the protocols, because they say the data is still lacking to include it in protocols. And also, of course, it has a lot of anti-cancerous actions. We know that ivermectin can block the glutamate-gated chloride channels, causing paralysis of parasites. Also can work on GABA receptors, making this paralysis even worse. And it can affect microtubules, decreasing the growth and division of cancer cells. It can cause WNT beta-catenin pathway that is important for division of cancer cells. It can activate T cells immunity against cancer. It is a P-glycoprotein inhibitor. P-glycoprotein is like a cannon that shoots something that the cell doesn't like outside the cell, protecting the cell. And many cancer cells, they make a lot of these cannons to shoot out all the chemotherapy we give to the patient, so they will gain the resistance. Ivermectin can block these cannons, meaning that cancer cells cannot get rid of chemotherapy, potentially meaning that ivermectin can improve the effectiveness of chemo drugs to overcome the resistance. For example, here we see the study 2024 that it can suppress many various cancer cell lines, including brain tumors. And really it's effective against, for example, glioblastoma, breast cancer, colorectal, prostate, lung cancers. But it's all preclinical, meaning it's not on humans. In general, both of these drugs, mebendazole and ivermectin, they are quite safe. Their adverse reactions are generally not dangerous, but even we have a lot of preclinical data nowadays, they are not officially used in cancer treatment. But there are some unofficial protocols and there are clinical trials and there are some case reports on real patients. We will talk about it in the next video. Also, we'll talk about dosages and adverse reactions. I want to thank everyone who supports this channel, and if you want to join them, you can also become our sponsor or just buy me a coffee. I would appreciate if you share this video with somebody who may need it and write any comment. It may help to make this video a little bit more popular. Anyway, I wish you good luck, God bless you, and goodbye. See you in the next video on mebendazole and ivermectin. You will hear a lot of important information there. Goodbye.